Hello, my friends, my family, and my fans. I am Andrew Ditch. I've been diagnosed with autism and intellectual disability. Today, I want to talk about a really important topic. This is very important for millions of other adults with autism. This topic shows how incompetent the medical and mental health field really is. You go to a doctor when something bothers you, like when physical pain, stomach problems, or even when your behaviors are not seen as the social norm. This is where I start with how incompetent doctors are in identifying autism and intellectual disability, and how they often can use masking as a way to misrepresent someone's behaviors as noncompliance or argumentative, rather than part of their intellectual disability or developmental disability. Broad mental health reforms, parity, and coverage laws. Mental health parity. Federal and state parity laws require insurers to treat mental health benefits comparably to medical/surgical benefits. When enforced, this can reduce visit limits and improve coverage. Below is a clear, expanded explanation of mental health parity laws and how they fit into broader mental health reforms, especially for autistic adults who face systemic barriers to accessing appropriate care. I'll keep it structured, practical, and connected to the larger themes you've been building. Globe with Meridian's broad mental health reforms. Mental health parity and coverage laws. Mental health parity laws are one of the most important, but often misunderstood, reforms in the U.S. mental health system. They were designed to stop insurers from treating mental health as optional or less important than physical health. When enforced, parity laws can dramatically improve access. When ignored, they become another layer of bureaucracy that autistic adults must fight through. 1. What mental health parity actually means. Federal parity laws require insurers to treat mental health benefits equally to medical/surgical benefits. This includes copays, deductibles, visit limits, prior authorization rules, network adequacy coverage for inpatient and outpatient care. In other words, insurers cannot legally charge higher copays for therapy than for primary care, limit therapy visits more strictly than medical visits, make mental health coverage harder to access, use stricter approval rules for psychiatric medications, provide inadequate provider networks for mental health. Parity is supposed to level the playing field. 2. Why parity matters for autistic adults. Autistic adults often need long-term therapy, trauma-informed care, autism-informed mental health support, medication management, crisis prevention, sensory accommodations, AC-friendly communication options. Without parity, insurers can deny coverage, limit visits, force people into out-of-network care, require burdensome authorizations, refuse to cover autism-informed adaptations. With parity, autistic adults have a stronger legal foundation to challenge these barriers. 3. How parity helps when it's enforced. A. Reduced visit limits. Parity can eliminate arbitrary caps like 12 therapy visits per year, 6 psychiatry visits per year. These limits are illegal under parity if similar limits don't exist for medical care. B. Improve coverage for therapy. Insurers must cover evidence-based mental health treatments, outpatient therapy, intensive outpatient programs, inpatient psychiatric care, medication management. C. Better network adequacy. Insurers must maintain networks that are sufficient in size, geographically accessible, timely to schedule. This matters because autism-competent clinicians are already scarce. D. Stronger appeals rights. If an insurer denies care, parity laws strengthen appeals, grievances, external review rights. Autistic adults can challenge denials more effectively. 4. Why parity often fails in practice. Parity laws are powerful on paper, but enforcement is inconsistent. Common failures. Insurers quietly impose visit limits, networks are too small to meet demand, autism-informed care is excluded as specialized telehealth coverage is inconsistent, prior authorizations are used as gatekeeping, appeals processes are confusing and inaccessible, providers don't know how to bill for autism adaptation, state agencies lack resources to enforce compliance. For autistic adults, Masking leads clinicians to underestimate severity. Competence bias leads insurers to deny services. Behavior-focused interpretations lead to inappropriate treatment. Autism-specific needs, see, sensory accommodations, are not recognized as medically necessary. Parity laws don't automatically fix these issues, but they give people leverage. 5. How parity interacts with other systemic barriers. Parity laws exist within a system that still has provider shortages, long wait lists, rural access gaps, waiver caps, program silos, child-focused infrastructure, lack of autism-specific expertise. Parity can improve coverage, but it cannot create more autism-competent clinicians, fix rural shortages, force clinics to accept Medicaid, replace inaccessible intake systems, solve sensory or communication barriers. Parity is necessary, but not sufficient. 6. Why parity is still a critical tool for autistic adults. Even with limitations, parity laws help autistic adults challenge denials, demand equal coverage, push insurers to expand networks, advocate for longer-term therapy access, trauma-informed care, reduce financial barriers, strengthen appeals when autism-specific needs are dismissed. Parity is one of the few legal tools autistic adults can use to push back against systemic discrimination in mental health coverage. Data gaps. Many systems don't track autism status in mental health datasets, making it hard to measure outcomes or hold programs accountable. Below is a deeper, clearer explanation of the data gaps problem, one of the most overlooked but structurally devastating barriers in autism and mental health systems. This piece fits seamlessly with everything you've been building about systemic failures, because it explains why these failures persist without accountability. Chart increasing data gaps, the invisible barrier behind every other barrier. Many mental health systems, state agencies, hospitals, insurers, crisis programs, and community clinics do not track autism status in their datasets. This means autistic adults become statistically invisible, even when they are overrepresented in crisis systems and underrepresented in preventive care. This is not a small oversight. It is a structural flaw that prevents reform. 1. What data gaps actually mean. Most mental health datasets track age, race, gender, diagnosis codes, insurance type, service utilization, hospitalizations, but they do not reliably track autism status, communication access, needs, sensory needs, AAC, use, intellectual disability status, masking, or support needs, whether the person is receiving autism-informed care. Even when autism is present, it may not be coded because clinicians miss the diagnosis. Autism is overshadowed by mental health labels. EHR systems don't have field for neurodevelopmental conditions. Providers don't know how to code autism in adults. Autism is treated as irrelevant to mental health outcomes. The result is a dataset that erases autistic adults. 2. Why this makes accountability impossible. If systems don't track autism status, they cannot answer basic questions like, how many autistic adults are in crisis care? How many are hospitalized? How many are restrained or secluded? How many receive trauma-informed therapy? How many are denied services? How long are wait lists for autistic adults? How many autistic adults drop out of care due to sensory or communication barriers? How many autistic adults die by suicide? Without data, agencies can claim, we don't see a problem. There's no evidence autistic adults are underserved. We don't have enough information to change policy. Data gaps protect systems from accountability. 3. How data gaps reinforce diagnostic overshadowing and misinterpretation. Because autism isn't tracked, autistic adults with depression are counted as depressed adults, not autistic adults with depression. Autistic adults in crisis are counted as behavioral emergencies, not autistic distress. Autistic adults misdiagnosed with personality disorders are counted under the wrong category. Autistic adults who mask are coded as high-functioning, not underserved. This hides the true scale of misdiagnosis, undertreatment, crisis, involvement, trauma, burnout, suicide risk. The system cannot fix what it refuses to measure. 4. Why data gaps hit autistic adults especially hard. autistic adults already face. Mask incompetence, bias, behavior-focused interpretation, misdiagnosis, siloed systems, waiver eligibility, barriers, rural provider shortages, crisis-driven access. When autism isn't tracked, these barriers become invisible, unmeasured, unaddressed. This is why autistic adults often say, "It feels like we don't exist in the system." 5. How data gaps affect policy and funding. Without autism-specific data, legislators underestimate need, agencies underfund adult autism programs, insurers deny coverage. Without consequences, hospitals avoid creating autism-informed crisis pathways. Waiver programs remain capped. Workforce development doesn't prioritize autism expertise. Rural regions remain unsupported. Data drives funding. No data equals no funding. 6. How data gaps affect research and quality improvement. Researchers cannot study autistic adult mental health outcomes, identify disparities, evaluate program effectiveness, track crisis patterns, measure the impact of sensory accommodations, study autistic burnout, understand suicide risk. Quality improvement teams cannot identify gaps in care, train staff, effectively build autism-informed protocols, reduce restraint or seclusion, improve crisis response. Without data, systems cannot learn. 7. The core insight. Data gaps are not just a technical issue. They are a structural form of exclusion. When autism status isn't tracked, autistic adults disappear from the numbers, their needs disappear from policy, their experiences disappear from quality improvement, their suffering disappears from accountability, their deaths disappear from statistics. This is why the system keeps failing autistic adults. It doesn't even know who it's failing. If you're interested in disability topics such as treatment, support, accommodations, and rights, like this video and subscribe for more inclusive content. I will talk to you on my next video.